Some of us, at the slightest cold, we have gone to a shop, but I don't want to say a pharmacy, a shop close to our house, and just say, please, Oga, give me Septrin, just as common cold or just cough. Or you are part of the people that when you are treating malaria, you are treating typhoid too. Hi guys, welcome back to my YouTube channel. My name is Inyoluwa Onofowokon, and on this YouTube channel I talk about faith, health, pharmacogenomics, fun and creativity, and every good stuff that you will like. If you are new to my channel, please subscribe so that you will get good videos as regards to your health. I like this video already. Thank you if you have subscribed. Now today I'm talking about something very important and something something I'm very passionate about. Maybe I'm passionate about everything as regards to, but this is one of the things. Some of us think that the health decisions we make, whether negative or positive, affect only us, but we don't see how it affects our neighbors or the global stage at large. And there is one of these health decisions that you make that affect the global stage at large, and that is antibiotic stewardship. I know it sounds like a big word, but it just means the proper use of antibiotics as an individual, as a nation, and a global stage at large. Now, you don't want to be using antibiotics improperly. And what are the ways people use antibiotics improperly? Number one, use of antibiotics without a proper prescription. Some of us, at the slightest cold, we have gone to a shop, but I don't want to say a pharmacy, a shop close to our house, and just say, please, Oga, give me Septrin, just as common cold or just cough. Not knowing that this cold or this cough can just be an allergy reaction, and without even first treating or using an anti-allergy or like maybe loratadine, we just go and take antibiotics because we feel like it's already a bacterial infection. Or some of us think that any slight fever is caused by bacteria. No matter how we are feeling, whatever is the sickness, we've added antibiotics. Or you are part of the people that when you are treating malaria, you are treating typhoid too. That is one of the ways you are using antibiotics improperly, or using antibiotics without a lab investigation, without knowing the causative agents, and maybe doing an antimicrobial susceptibility test, knowing which antibiotics will be used to treat that bacteria on its own. That's another way to use antibiotics improperly. The third way to use antibiotics improperly is not finishing your dose, not completing your dose. You are giving an antibiotic for 7 days, 5 days, sometimes 14 days. And once you feel better, maybe once the fever is gone, you just start saying that, oh, I'm not completing it, or you keep it for another time that you have an infection, or you just, some people just use like just 3 doses, so far they are fine. And that is one way of using antibiotics improperly. Now, take for example, two countries, they are in a battle, they are facing war. Imagine this country A, is like powerful, they are more powerful than country B, and country A goes to country B and fights country B, but they did not kill all the soldiers in country B, they just killed some of the soldiers. What do you think would happen to country A? Country B will have, the soldiers that remain in country B will have learned the skills of country A and use it against them. So this country B will be able to win country A. That is what happens when we don't finish our antibiotics, because the antibiotics go into your body, they try to treat it, but when you don't use it, when you cause a halt on your treatment, some bacteria are still left in the body, and they get to learn how these antibiotics have tried to maybe stop their work, and they use it against the antibiotics. So they try to, you know how us too, we try to, human beings try to survive, we get to heights of survival. These bacteria too, they know how they will survive that kind of antibiotics again when you use it. That's what causes resistance. So sometimes if they learn how to maybe make sure that the antibiotics, they build a shield around themselves, the antibiotics is not able to penetrate, or they just look for a way, maybe create an opening in their body that even though the antibiotics enter, it will come out from. So that is how it is when you don't finish your course of antibiotics. And when you use antibiotics without even knowing you have an infection at all, it's just like there are good bacteria in your body protecting your body, and maybe you didn't have a bad bacterial infection and you are using the antibiotics or the antibiotics. That means you are trying to kill those good bacteria, and that is bad for your body. So whatever way you are doing this improper use of antibiotics, it is good to stop. Now you might be like, oh, is it not just my body, or is it not just this neighbor's body? I'm doing my own. But let me tell you how bad it is. Now let's say that person A has been misusing antibiotics and using them improperly, and he has a lot of resistant bacteria, has a resistant bacterial infection. Let's say that is a respiratory tract infection, and it is that bacteria causing it is resistant to antibiotics, and the person sneeze into their palm and they shake the other person, and maybe the person doesn't do proper hand washing or picks their nose or whatever, and this person with that same hand they used to shake this other person picks their nose. All of a sudden this other person that has been trying to be using antibacterial properly will get to have that same resistant infection. Now imagine that person shakes 100 people a day that don't wash their hand. Can you see the big picture? Can you see that it's not just about you? Another thing I want to ensure is that we practice proper hygiene, since this is already like a global issue, that when we shake hands, whatever we do, we are washing our hands, we are not putting dirty hands into our nose, our hair and everything. But I just want us to see that because you are making an improper decision to abuse antibiotics or any antimicrobial, it will affect your neighbor, affect the world at large, because it's already affecting. There are several people with multiple drug resistant, multiple antibiotic resistant infections, several people, and it's alarming because there are no new drugs coming in, but these drugs that we have, people are getting resistant to it. So if you are guilty of any of these habits, I know that you might not have known better, but today is a day to change and to stop misusing antimicrobial, whatever, if it's antifungal, whatever is the antimicrobial you are using. But I'm using antibiotics because that's what most of us use. Some people use antibiotics to flush their system. That's not right, that is improper. So please let us make sure we use antibiotics properly. First, by using antibiotics when and only prescribed after a proper laboratory investigation, and secondly, finishing our course of antibiotics when prescribed, and third, let us practice proper hygiene. I know you learned so much, but more than learning, I want you to put this into action. Please subscribe to my YouTube channel for more videos as regards your health. See you in my next video. Bye.